I'm calling because last night Emma had a fever, and all of a sudden she started having seizures.
Sorry to hear that. Was this her first time having one?
This had never happened before. I had no idea what to do. How come no one had ever told me that this could happen? I was so scared.
Hello. As a medical professional and a parent, I can relate to both sides of this conversation. Witnessing an unexpected seizure can be a scary experience, especially if it's your child. Many caregivers are unaware that fever could lead to seizures. Nurses have an important job to teach our patients that young children under the age of 5 are more susceptible to febrile seizures. To decrease likelihood of injury and fear, we must know how to protect little patients before, during, and after febrile seizures.
Febrile seizures is caused by a spike in body temperature or from an infection. Infants and younger children are at risk due to their young age and to the fact that they are more susceptible of having higher body temperature. Some clinical manifestations of febrile seizures are loss of consciousness, jerking, eye rolling, higher fever above 100.4 degrees Fahrenheit. The best way to handle febrile seizures is to prevent it by using cold therapy or some medication to keep the fever under control.
As a parent or a caregiver, I would want to know what to do in the event of a febrile seizure. I would also want to know what to expect after a seizure has happened. And lastly, it would be important to have some guidance on when to call 911.
Thank you for calling in for your appointment. Your daughter is scheduled to come in for her MMR vaccine next week. Do you have any questions?
Yes, I do. Are there any side effects that I should be concerned about?
Great question. For MMR vaccine, your baby may experience some soreness, redness, or rash at the site of the shot. Fever may also occur after a shot. And since we mentioned fever, let me tell you about febrile seizures.
What is a febrile seizure? That sounds very concerning.
Well, I do not mean to worry you. It's about 3 to 5% of children with high fevers can suffer from seizures. It is very unlikely, but help to know about it just in case. Most febrile seizures are short and they do not cause any long-term damage.
Okay. That still sounds very serious. What would I do if that were to happen?
Yeah, if that were to happen, it is important not to restrain or hold Emma. Instead, gradually place her on the floor to prevent accidental injury. It is best to position Emma on her side to prevent choking. If she has something in her mouth, you'll try to gently remove it. Nothing should ever be placed in her mouth during a seizure. And call our emergency line as soon as it is over.
Do you feel more confident in guiding your patients? I hope so. Patient education plays a critical role in preventing injury and fear, and this video was created for that purpose.